Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 2nd, 2025. This long video is on patent foramen ovale and stroke, a review published in JAMA online July 28, 2025. PFO is present in 25% of the adults. Prevalence 50% prevalence in patients below the age of 60 with cryptogenic stroke. PFO related paradoxical embolism accounts for 5% of all strokes and about 10% in younger adults. Pathophysiology: paradoxical embolism via right to left shunt occurs through PFO. Venous emboli bypass pulmonary filter and enter the systemic circulation. An alternative mechanism, in situ thrombus formation in interarterial tunnel. Diagnostic workup: exclude large vessel atherosclerosis, atrial fibrillation, and small vessel disease. Prolonged rhythm monitoring recommended 24 hours to 6 months. TTE with bubble study, sensitivity 71%, specificity 99%. Transcranial cranial Doppler bubble study, sensitivity 96%, specificity 90%. TE with bubble study is a gold standard, sensitivity 89% and specificity 91%. RoPE score and PASCAL classification. RoPE score is the risk of paradoxical embolism, scored from 0 to 10, includes age, stroke history, diabetes, high blood pressure, smoking, and cortical infarct. A RoPE score greater than or equal to 9 is associated with a PFO attributable fraction of around 90%. A RoPE score less than or equal to 3 is associated with 0%. PASCAL is a PFO associated stroke causal likelihood classification. It combines RoPE with echo anatomy. Most importantly, high risk when there's large shunt greater than 20 bubbles. Atrial septal aneurysms equal to or greater than 10 millimeter excursion also are a high risk for stroke. Therapeutic options: medical therapy, antiplatelets, or anticoagulation. PFO closure device, typically double disc via femoral vein. Endothelialization occurs over time post-deployment. Clinical trial evidence: meta-analysis of 6 randomized controlled trials, which included 3,740 individuals, hazard ratio 0.41 for stroke recurrence with closure. In PASCAL probable classification, a hazard ratio of 0.10. The absolute risk reduction is 2.1%. The number needed to treat is 47%. In PASCAL unlikely, the hazard ratio is 1.14, no benefit, and there is higher AFib risk. Adverse events of closure: atrial fibrillation in 5% with closure versus 1.1% with medical therapy. Serious complications: vascular injury, tamponade, and rare death 0.3%. Post-closure AFib greater than 45 days, 2.4% in those post-closure versus 0.8% in the medical group. Older adults and uncertainty: limited randomized controlled data in those above the age of 60, only 34 older patients. Observational studies suggest benefit but prone to bias. Uncertainties: management of post-procedural AFib, TIA, and the role of DVD screening. Antiplatelets versus anticoagulants. Meta-analysis: recurrent stroke 3.2% with anticoagulants versus 5.5% with antiplatelets. Relative risk 0.59. Lot of heterogeneity in regimens in trials, so no definitive comparative conclusion. Guideline recommendations. Guidelines recommend PFO closure in someone below the age of 60 with cryptogenic stroke and high risk anatomy. Long-term antiplatelet therapy post-closure suggested. Ongoing trials to clarify benefit in older adults and with the different device types are being conducted. To put it in a nutshell with these FAQs, What is patent foramen ovale? A persistent fetal opening between atria present in 25% of the adults. How is cryptogenic stroke diagnosed? After excluding all known causes using imaging, EKG, labs, a stroke is deemed cryptogenic. What is the RoPE score? It predicts stroke causality using age, risk factors, and cortical infarcts. The scoring is from 0 to 10. What is the PASCAL classification? It combines RoPE with echo features to classify causal likelihood of stroke. Who benefits from PFO closure? Patients below the age of 60 years with high RoPE scores and high risk PFO anatomy. What is high risk anatomical features? Large shunt, greater than 20 bubbles, and atrial septal aneurysm, greater than 10 millimeter excursion. How is PFO closure performed? Via catheter device across the interatrial septum, being endothelialized over time. What are the risks of PFO closure? Atrial fibrillation, bleeding, vascular injury, cardiac tamponade, and rare deaths in about 0.3%. Clinical considerations. Does PFO closure benefit older adults? Unclear. Limited randomized control data. Observational studies suggest possible benefit. I don't know. My uncle was about 65 when they diagnosed an ASD and they recommend closure. He declined. He's doing fine. What is the risk of anticoagulants versus antiplatelets? Antiplatelets may reduce recurrence more than antiplatelets. Relative risk 0.59. Should all PFOs be closed? The answer is no, only those with probable causality and low procedural risk benefit. Celebrities who had early stroke and underwent PFO closure include Hailey Bieber, comedian Catherine Cohen, and TV star Teddy Dubrow, Bret Michaels, the rocker. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.